Hi, my name is Andreas. I'm Director of Audiology at Hearing Solutions, and one of the questions that comes up often in the clinic is surrounding sudden hearing losses. Sudden hearing losses can be very alarming for individuals that experience them for good reason. I mean, when your hearing is there one day and then suddenly it changes the next, that should be alarming. It's not how hearing loss presents for most people. Most people, hearing loss changes gradually, whether it's from noise or aging or other factors. Those day-to-day changes are very, very small, and people might not even be aware of them. But sudden hearing losses are dramatic. And so most often what happens is people will rush into the clinic and say they need an appointment right away. And that's a good thing. We want to see people who have a sudden hearing loss right away. It's actually very important. One of the first steps is to understand how much the hearing has changed and where it's changed. If the hearing is changed due to a conductive problem, something like a blockage in the ear or infection, it's a very different context than if something has happened at the nerve level. And so that's one of the most important things we have to determine early. When the hearing is changed at the nerve level very suddenly, it's important because the next step is to refer them to the hospital. The reason we want to send them to the hospital is because often the cause is something that can be reversed, but when it can be reversed, it needs to be treated right away, very rapidly. And so we generally want that to happen within, a day or two tops. What happens at the hospital is they'll generally get steroids. And for many people who experience a sudden hearing loss, the hearing loss can be reversed if they can get that treatment right away. So it is very important to get into the clinic right away and then get that referral if it's deemed that your sudden hearing loss is of a nerve-related nature. Now, nerve-related hearing losses are extremely complicated. There's a lot of things that can cause them, things like viruses and ischemic events where blood supply is maybe not getting to the hearing nerves and damage is caused as a result. So there's a lot of different things that can happen, but the most important thing is identifying what type of sudden hearing loss has happened, and then if it's a nerve-related in nature, that we refer to the hospital, because for many of the patients, we're able to reverse it if it's treated early.